Right now, the average American spends more money on healthcare than nearly anyone else does in the entire world. In fact, the average American will spend every single year more than 3 times more on healthcare than the typical British person does. And it's little wonder why that's the case when we realize that the typical hospital bill in the US is over $3,000 a night. And that is in large part because hospitals will charge up to $15 a pill for Tylenol, something that is worth usually only a few pennies. And so seeing this, it made me wonder what exactly led to this issue where most Americans cannot afford to get sick. There are 3 main reasons, starting with this one. This is called a Chargemaster. It's an itemized list of every single item a real hospital could charge you for, along with the prices they would have billed you for if you used this good from them in the year 2023. Now, it is over 11,000 lines long, and so I only want to show you a few very interesting examples from it, starting with how this particular hospital would bill you over $13.50 for a small cup of mouthwash. Not the huge bottle that you would buy at the store, just a little bit for after dinner if you wanted to wash your mouth out. But maybe that doesn't seem too extreme. If not, this next example probably does, which is that a single vitamin K capsule, just a little pill, a little vitamin you could buy a whole pack of at the store for $10, would cost you at this hospital over $264. And it gets worse, because if you had a large wound that needed a larger band-aid than usual, what this hospital would provide you with is a large square gauze strip. And do you want to guess how much they would charge you for? The answer is nearly $800 for a glorified band-aid. Now, this is where things get really interesting, because hospitals will bill this incredibly high pricing because they don't actually expect to get paid it. Instead, what they expect is for insurance companies to be fronting the bill for most medical costs. And insurance companies will scoff at extremely large bills. Instead, they will use their leverage to negotiate lower prices, which, to be very clear, is good for consumers in this case. But what it means for hospitals is that they know if they're billing $100 for something when they really want $100 for it, insurance companies might say that's only worth $20. And so what hospitals will do is say, okay, if we want $100 for a gauze strip, we'll bill it at $800 nearly and negotiate with the insurance company down to $100. Basically, we'll set a really high price to begin with as a price anchor. That way, when we negotiate down, we can get toward what we actually wanted all along. Now, all this sounds like just generic corporate negotiations and stuff that happens in back rooms that doesn't really matter. The problem is it has a pretty major upshot, which is that if you ever need to see a doctor who is not in your insurance network, you are going to pay an obscene price. And that might happen for any number of reasons. Either you become uninsured at some point because you're switching jobs and you don't have health insurance when you need to see a doctor, or even because you just need to go see a specialist for something that's incredibly important that no doctor in your network can see you for anytime soon. Whatever the case might be, if you are ever in that spot and you see a doctor that is not covered by your insurance, then you're not getting the nice prices your insurance company negotiates down. No, you're getting the exorbitantly high prices shown earlier in this Chargemaster because you don't have anyone interceding on your behalf to get you a lower rate. Which means that most people are way closer to an enormous medical bill than they realize if something bad happens where they need to see a specialist that's not covered, or if they ever lose their job and then need medical care. And all of this is only the first reason why medical bills are so expensive, which takes me into point number 2.
Ozempic. It is literally the hottest drug in the country right now.
It's a weight loss gold rush.
Ozempic and Wegovy are game changers.
So right now you're probably wondering what Ozempic has to do with the price of medical care in the United States. And the answer is everything. Look at this chart. It shows how much a 1-month supply of Ozempic would cost you in different countries. How much the same thing would cost you country to country to country. As you can see, most nations are fairly well clustered together, with the big outlier being Japan costing 2 times as much as France, but even then, at least stuff is within a general ballpark. Now, what happens when we add America to this chart? All of a sudden, America blows every other country's prices out of the water, because a 1-month supply of Ozempic in the United States goes for 11 times what the same exact product would cost you in France. That's right. What would be a nearly 1-year supply of Ozempic in France is what you would have to pay for 1 month of that same drug in the United States. And so if a pill would cost a major company a penny to make, they can still sell it for $1,000 a piece because no one else is legally allowed to make the same product as them. So basically they recoup their money on research and development by charging incredibly high profit margins. And while that might be uncomfortable, there is a fair argument to be made that if that were not the case, that no one would invest in research and development for new pharmaceutical drugs. Here's where it falls apart though.
The vast majority of medicines associated with new drug patents are not new. Nearly 8 out of 10 are for existing ones, like insulin or aspirin.
Patents are supposed to last for a set period of time. Big pharma companies don't like that fact, and so they decided they would ignore it. And they found the loophole to do it, and the government let them. What they would do is create a new patent for a drug evolution, not one that actually, improves patient outcomes. No, that requires too much further research. Instead, they would change something inconsequential, something that doesn't matter whatsoever, but is just enough to get the Patent Bureau to issue them a new patent, protecting their monopoly on this specific drug that people will pay for in many cases because it's life or death for them for far longer than it was supposed to be for. Now, the third reason why healthcare is so expensive is because every year fewer people can afford healthcare. That sounds odd, right? Let me explain. In the US, if you go to an emergency room, they are required to take care of you. And that's because the legal principle underlying the entirety of America's healthcare industry is that the patient's care comes before anything else. And that is a good and vital thing, because the last thing you would want if you're ever having a heart attack is to show up at the hospital barely able to breathe and there being some receptionist saying, "How do you plan to pay for today's visit?" That would be horrible. And so thankfully, that's not how it works. But that creates a glitch in the system, because what happens if someone goes to an ER, receives $100,000 worth of medical care, but they don't have insurance and can't afford the bill when it comes due? Now, obviously, the hospital will do whatever they can to collect any debts they're owed, but at the end of the day, they recognize some people do not have the money to pay them back for the services they receive in an ER. And so the hospital realizes that they'll lose money on uninsured patients. They realize they will lose money sometimes on people out of network who receive care. And they want to make that money up somewhere. And how they do it is by charging people who have insurance even more. In fact, because of this, for the first time since the end of the pandemic, we're seeing a rise in people not having insurance, which makes sense because when people can't find work, they can't get health insurance through a job, and they certainly in that case cannot afford insurance on the open market. And even for people with jobs, if their health insurance premiums go up too much, they'll just quit paying for it eventually, which further exacerbates this problem where the more uninsured people there are, the higher costs will become for people who are insured, which raises the prices even higher for health insurance, which means that more people can't afford health insurance, and the cycle will continue and continue until something breaks. And so taking all three of these things together, I think it becomes exceptionally clear why Americans pay on average over 3 times more for healthcare costs annually than British people and most Europeans do. Okay, with all that said, there are 2 policies we need to implement that would make meaningful progress toward fixing the problems mentioned in this video. So the first policy we need to implement is banning the patent manipulation that we mentioned earlier in the video. It's called patent evergreening for the official term if you want to look it up, but basically all we need to do is say that you cannot get a new patent to extend a previous one. Yes, companies should be allowed to make money off of their new products, otherwise we wouldn't have research and development. But at the same time, There is a reason patents only last for so long, and when they can be extended functionally indefinitely, it means that companies are milking profits at the expense of actual people who need access to healthcare. And that's just messed up. So we should remove the ability to get lifelong patents for something that was never intended to have a patent that extended beyond a set time frame. And the second thing we need to do is increase transparency with hospital billing. Yes, it is true that right now hospitals have to have a Chargemaster, like we looked at earlier, showing their prices for things, but that's not well advertised. It's complex, and if you don't know what you're looking for in it, it's a sea of 1,000 different things. And so because they're able to make it so confusing, most people aren't going to know how to use this. There needs to be an effort to make more transparency in this, where you can look up in your area hospitals that can provide you a service you need and you can get an actual good faith estimate on how much it would cost you at multiple different locations. That way you can pick wherever is going to maximize both your medical care and saving you money. And if we did that, if we created more transparency in the medical industry, prices would go down, because suddenly the leverage would quit just being on the side of hospitals and insurers and bring it back toward consumers, which is the whole goal we need when discussing healthcare results. Now, to be clear, these policies would not overnight fix the entire healthcare industry, but they would be a start, and they would meaningfully reduce the price the average person is having to pay on healthcare annually. Thank you so much for watching. If you enjoyed this video, please consider subscribing, and if you want to see more content just like this, I recommend you check out my video here on how the government hides the actual inflation number from you. If you enjoyed this video, I know you'd enjoy that one. Have a great day.